Hello, and welcome to this installment of the Galen Healthcare Solutions webcast series. Today's topic is one that is top of mind for many healthcare organizations today. Whether considering outsourcing application management for the long haul or as a stopgap for legacy systems as your team transitions to a new platform, finding the right team is mission critical. I'd like to take a moment to tell you a little bit about our team and who we are. Galen Healthcare Solutions is a boutique healthcare-focused services and solutions company. Staff is comprised of clinical workflow and operations experts who have an average of 12 years experience in the field. One of the key factors of our success is our company culture. Our expertise is both wide and deep, and our employees regularly make themselves available to each other in order to ensure the highest quality of services to our clients. For over a decade, Galen has built a solid reputation of providing high-quality, expert-level IT consulting services to health systems, hospitals, and physician practices. Today, we're going to be talking specifically about application management services, which is only one of the many services that we offer. We provide world-class technical and professional services to healthcare organizations that interoperate, aggregate, convert, harvest, and optimize clinical patient information within their multi-vendor systems, including practice management, electronic health records, and health information exchanges. Additionally, we deliver a suite of fully integrated products that enhance, automate, and simplify the access and use of clinical patient data within those systems to improve cost efficiency and quality outcomes. If you are interested in hearing more about any of these services listed in the slide, there'll be contact information at the end of the presentation. So now we get to the good stuff. I have been working directly with application management for the past 2 years, and the agenda presented today on this slide reflects the topical areas that we know to be critical key components in understanding the operations of our client partners and to seamlessly step into essential roles within their organizations. I am a storyteller by nature, and the intent of this webcast is to share a collective story of application management and support and the lessons we've learned, the best practices we've accumulated, and the insights that we've gathered. Once, I was called when a key person at a client I had went out on medical leave, and I was asked to just be this guy for a few weeks. More recently, I've been asked to play this role as the lead admin in preparing for a conversion and implementing a brand new software product. Organizations can't afford to not have a key person on their team when they're transitioning to a new product, but they also can't afford to not have that person on their legacy team. And so in this situation, we're often called upon to help be that stopgap person or team. You need to find someone to fill this role who is not just an expert in the applications that they're using, but also someone who understands relationships and how to work as a team. And as with many things at Galen, this webcast was a team effort. I'm excited to be able to introduce you to some of my favorite people. Contributors to today's presentation include Kim Baxter, Laura Gold, Sarah Whitaker, Tracy Kimball, Catherine Howell, and Cece Teague. From these contributors, 3 will be speaking today. Kim will start with a discussion of discovery required for both physical environment as well as operational structure that we need to understand when we're engaging with a new organization. Cece will discuss the onboarding and transition methodology we use, and then Sarah will take a deep dive into the work itself. I will be at the helm fielding questions as they arise in the chat box and verbally at the end of the call. Here's Kim to start us off.
Hi, thanks. Welcome to our webcast, and thank you for joining us. So one of the first things I'm going to talk about with you is knowing our environment. To be a good support for you, not only do we need to know our applications well, but we also need to know and understand the environments they reside on. So we need to know everything about the architecture of your server farm. This allows us to see what feeds into, what data comes out of all the applications that we will be supporting. And many times during this review, we find little one-off applications, interfaces, or other types of connections that could have been overlooked during the initial scoping of the project. Also, with that being said, we need a spreadsheet. As you can see by this screen that I have up here, the flow sheet of the servers and all the ins and outs doesn't give you all of the information you need to know about that environment. So we need also the spreadsheet that tells us the system environment specifications of these servers. We also need to know what resides on each server. Sometimes you might have a database server, and if you've got an application that has a very small database, you don't want to waste all that resource on that one small database. You might have several other small databases sharing that server. And it's good to know that, so that when we are doing support work or upgrades or troubleshooting a problem, if the other databases that reside there belong to applications that are supported by another team, then we know who to reach out to and coordinate efforts, so that if we have to have a reboot or some downtime, that we know when it's going to be less impacting on them, or can bring them in to make some decisions on when that needs to be done. We also need to know the IP addresses of the servers. We need to know if it's a cluster, if it is, what's the active node, and that type of thing, and the spreadsheets can tell us that also. Don't forget, when you provide this to your support team, don't forget to include any test environments, training and development, staging environments, because we need to know all of those as well when we're supporting you appropriately. The next thing we want to talk about is what all falls under our umbrella. What all are we responsible for, and how do we handle doing things the way you've always done them? We need to have discussions on what that role looks like for us within the whole IT reporting structure for your area, for your organization. At a minimum, we want to be mindful of shared duties for applications that might overlap with other teams. For example, an organization that we've recently been working with, they have the acute side and the ambulatory side, and they both share a patient portal. However, the acute patient portal functionality is supported by one team, the ambulatory side is supported by our team. And what we have to do then is coordinate efforts. If a patient is calling and saying that they're having issues with something, trying to decide if they're discussing results that came from the acute side or the ambulatory side, if there's data integrity issues, where is it and whose responsibility is it to troubleshoot that and work with the vendor to get that taken care of, and upgrades and that nature, who handles the upgrade? Does the acute side team, are they primary on those types of things, or are we the primary resource for those, or do we share the duty equally? Understanding these boundaries and the support structure and who we'll be interacting with, and developing a working relation with that team and for cohesive is very important. It's important not only for just the camaraderie of the teams working together, but also for the vendor and for the patients if they were to have problems. So we need to be a unified front when it comes to those people, and knowing each other and building that relationship helps bring that to the forefront even more. The other caveat to knowing our role and fully understanding what we do and where we fall is with all of the downstream and upstream applications that we have. Like I said in the previous slide, there's been many times that we've, in scoping the project, we did not realize that there were these small little applications out there, because they were web-based, that we didn't catch And then when trouble came or an upgrade came for that little application, or things quit feeding into our system from that application like it was supposed to, nobody knew who was supposed to support that and where to find the documentation and how to work with the vendor and what our account number even was. So it's very important for us to really lay out everything we can think of and to discuss the what ifs and how that is going to be handled if things like that come up in the future. How does the system handle customizations? How does the system handle all kinds of other things? Who monitors the interfaces? Does your team monitor the interfaces that are related to your applications? Or do you have an interface team that does all the interfaces and they just come to you if there's a problem? So those are all things that we need to understand well so that we can provide the best service to your organization that we can. Then there is the whole aspect of how do we connect to these systems? Do we enter your organization through a secure link product or Citrix or through a VPN connection? Maybe we VPN through a portal and then we have an assigned virtual desktop that we log into, and that's how we access all of your applications. And not only that, once we are on your system, if we are not locally, how are we going to reach a user if we need to remote a desktop onto a user's workstation? How are we going to do that? Are we going to have admin rights to the PCs so that, or the user's desktop so that we can replace an icon if it goes bad, or reinstall a printer, or reinstall a scanner, or help a physician work on their Dragon or speech mics or something of that nature? So how is that done? Is it through VNC? Is it a join me session? Do the users need training? Maybe they've never had to do this before. They've always had someone on site that's just ran over and worked with them one-on-one, face-to-face, and so they've never had to deal with this before. So do we need to educate the users and let them know this is the way it's going to be and this is the things that we need from them to help support them the best? And then last but not least, when it comes to connectivity, many times we've been in a situation where we thought we had it all worked out and this is the way we're going to remote into the user's PCs, or we're going to log into the system, and then licensing has become an issue. We've ran out of licenses. Who's going to pay for those additional licenses? How long does it take to get them? We need to look at all of that information prior to beginning our support for your organization so that we don't have those roadblocks in the way once we're ready to get going. And then, of course, last but not least is who's who. We need to know who we're talking to. We need to know the staff that we're going to be communicating with, the providers that we're going to, we don't have to meet them all, but it's good to have a very good overview, an org chart of organizational structure of who everybody is that we're going to talk to. And not only with that, what roles, if they do play a factor, what roles do they play? Do they sit on committees that we need to be aware of? And how do we communicate with them? So for example, like I have on the slide here, let's take your change control policy. So what is the change control policy? How do we complete the paperwork, or is there a share drive that we submit documentation on before each change control meeting? If it's an urgent break fix or something that has gone down, or a release to fix a problem, a patient safety issue, for instance, what's the policy on that? Do we need to run it past a steering committee via email? Do we need to is there an urgent, weekly urgent break fix committee that we need to run it to? How do we do that? Who do we report to? How do we report it up through the chain? What documentation is required? Does it need to go to IT leadership? Is there a physician committee? Let's say your note templates need to be changed for all of your orthopedic providers. Is there an orthopedic provider committee that sets down, or is there just an EMR committee that we need to report those changes to and get approval before we make these changes? Those are very important things that we need to know. And another issue is that we see quite often is we'll get a user will say, hey, I need access to XYZ and I don't have it. I need to be able to do this function in the application and I cannot do it. Who does that need to come from? Does the manager need to put in a ticket? Does it need to go through the security and privacy to get the any kind of changes made there? How does that work, and what's the policy on taking for granted who's okay to give that? We are not well versed on how the chain of command goes at each site and people's names and faces, so we need to know for sure who we're talking to and where they stand within the org chart and what we need to do and how we can instruct them on helping them get what they want. And then there's the setup on vendor sites. Vendors, sometimes it's hard and it takes a little time to get set up so that we can submit issues to vendors and get them to work with us on behalf of the client. So we definitely want to make sure we have all of that set up before we get started. You never know, day one, something might break and we need to put in a ticket that day with the vendor. So we need all of that set up beforehand so that we can get that working and not have any kind of interruption in service for everybody. So with that, we are going to talk about onboarding, and Cece, I'm going to hand it over to you.
Thank you, Kim. This is Cece, and I'll be presenting the onboarding and transitioning processes that we use to lay the groundwork for our successful management of our clients' applications. As Kim talked about in relationship to developing our understanding of client environments, at the beginning of a project, we go through a discovery phase, prioritizing our clients' needs and requirements. This allows us to develop a customized onboarding process that is as efficient as possible. We use an internal resource specifically dedicated to managing this process with clients. So by centralizing our record keeping of background checks, drug screenings, health screenings, and IT agreements, we can efficiently share the information as needed with our clients. In addition, in an effort to ensure continuity of services with our clients should one of our consultants have to leave a project unexpectedly, Galen onboards at least one additional consultant per project. This allows a fast and smoother transition if required at any point. Our background checks are handled through our human resource vendor and are kept on file and available if requested by a client or needed for an audit. The federal and state criminal checks are a 7-year history and include sex offender registry searches. The drug screening tests require a clear 9-panel urine drug screen. And like the background checks, these are not typically delivered to the client but are kept on file here at Galen. Our health screening includes records of immunizations that are commonly requested, along with evidence of up-to-date shots like the tetanus shot or a flu shot. The health screening is most commonly required when a consultant works in patient care areas at client sites. The IT agreement lays out the rules for confidentiality and access to a client's information technology and computer systems and applies to all non-public patient and business information. The client side of the onboarding process includes providing access to networks and applications. The length of time it takes for access varies depending upon a client's internal processes. We work closely with our clients to go through their steps in a timely fashion, because often our ability to start working for the client depends upon our consultants having access to the required systems. Some clients require Galen consultants to have in-state fingerprinting completed, and if this is the case, it's usually done the first week we are on site at the client's location. Once the required background information is completed and distributed as required, the actual transition of work responsibilities begins. Galen's approach for transitioning into managing client applications depends upon different factors in play for our clients. It depends upon things like our overlap time with the client's existing team and how long the people will be available for us to work with. Who on our team does what and how many are needed will depend upon our clients' goals for our application management. And even as we move forward with our plans, we are well aware that we may need to quickly adjust and change something as our experiences develop in the transitioning process. So in summary, our approach is to be nimble and flexible to best meet our clients' needs. To support our approach, we have a designated lead on our team to manage the transition and ensure that we have all the resources and information needed to do the job as effectively as the client's current team. To begin the transfer of knowledge, most clients provide an introduction to their organization similar to a new employee orientation. Our consultants will interview the people they will be replacing to discern their day-to-day activities. And we, of course, appreciate access to all available documentation on things like workflows, system builds, and other reference materials. Many times, actually sitting with a client resource while they are working through their day provides invaluable information for us. The time provides the consultant an opportunity to ask questions and uncover information that may be important, but may be overlooked to share just because it's so familiar to the client. So with this overview of our onboarding and transitioning processes, I'll now turn the webcast over to Sarah Whitaker, who will be providing further details of our application management methodologies.
Thanks, Cece. When resourcing our help to an outside group, transitional flow is very important. We strive to provide a better level of service than you were receiving before the augmentation. The goal is for the change of hands to be so smooth that the end users are unaware of it. To achieve the goal of superior experience, we have a multi-check system we run through. We thoroughly investigate current practices and workflows, keeping an open line of communication between organizational leaders, managers, and support staff. Having a clear understanding of where organizational responsibilities lie with the existing or newly created staff and their leaders allows us to know exactly who is responsible for each piece of the puzzle. You may say and think to yourself, our organization is not going to allow any changes to our existing legacy system during the transition. But this is not a realistic statement. If there is one thing we know to be a constant in life, that is change. Things are always changing and we are used to adapting. With every transition, there is a timeline made, from the decision to change EHR vendors through the final go-live, implementation, and completion. Depending on the size of your organization, this has often been known to take up to or over 2 years. And we all know in 2 years many things can change. For example, reporting standards can change. Patient safety issues may present themselves. Equipment may need to be replaced or updated. Your key vendors could leave the workspace, or important personnel on your staff may take a leave of absence. There are many more. We will now be reviewing some of the areas to be aware of and to plan for. There's a lot to think about when you're turning over your IT system to a new team. Here, we have listed out some of the most important tasks that need to be discussed before the transition. What applications will we be assuming? responsibility for. Some examples may include the EHR itself, patient management systems, phone software such as Telebox, messaging systems, prior authorizational software such as Navinet, merge tools, etc. Us becoming your help desk. Within the applications that are now turned over, are there Tier 1 versus Tier 2 support? Are there SLAs, service level agreements for the specific programs? Workflows. The operational chain of command. Who does what? Do you have staff on your team who are solely responsible for one key piece of the system that others may be unaware of? Providers, practices, and users. Will you be onboarding more staff while the rest of your staff prepares for a transition? Who will be responsible for onboarding and training those new staff members? Go-live support for the new practices and new providers. What is the number of support staff on site? How long are they there? Do they get follow-up visits? Daily, weekly, monthly, and operational tasks. Credentialing, such as keeping up with the DEA's licenses and insurance carriers. Value and quality-based incentive programs. MIPS, PQMH, PCSH, CQS, reporting and gathering tools. Documentation. Is it internal? Where is it stored? Drives, shares, and who has access to that information? At Galen, we pride ourselves on our wealth of knowledge and our sharing of that knowledge. We start every project with 3 main steps: hear it, see it, and write it. The best way to find out how a team is currently producing is to sit with that team to observe their workflows and interview them as to the where, when, why, and how, and who of their daily life. What do they consider are the challenges and current struggles in their day-to-day work environment? Often, we come in with a fresh perspective and the experience of having worked in multi-systems with multiple approaches, so we may be able to recognize areas of process improvement. Observe and interview. I cannot stress this enough. Your new augmentation team will be only as good as the support documentation that is available to them. It is imperative to factor in the time to allow the augmented staff the opportunity to interview your existing staff in their day-to-day functions. The interview process should take place over at least a week, longer if it is at all feasible, to cover every day of the week. If you have a large organization with many moving parts and roles and responsibilities that are going to be assumed in this process, we would need longer than a week. For good measure, we interview more than one person in the same role as often as possible. Person A and B may have the same role, but their responsibilities may be very different. For an example, you may have an organization with 2 teams of trainers. Both are working with staff and providers, but they are working in 2 different programs. It is imperative for us to know who does what and the level to which these users are being trained. The observation process allows for discovery in the real-time work environment with practical real-time scenarios. It also allows for workflows to be observed that may not be documented well within the health system. In anticipation for augmentation staff coming on board, you probably created an outline of the duties that are performed by the various departments within your organization. But I can guarantee you that your users and staff are doing work that needs to be done but is not documented anywhere, as to how it is done, why it's done, when it's done. For an example, error queues. Different clients utilize different departments to address the errors, the labs, the interfaces. How are they going to be divided up with your new team? This is one of the benefits of the observation process. You really see what's being done, and if it was not previously documented, it is now. That way, in the future, when that random thing comes up that you must know how to do, that only happens once a quarter, you'll have the documentation to get it done and to ease the stress. The help desk. How many applications are being supported by the new team? We talked about the electronic health record, the patient management system. How about phone systems? Do you have any third-party add-on applications such as Midmark, Phreesia, etc.? What's considered a Tier 1 versus Tier 2 ticket? What do you consider a password reset? What is your current service level agreement expectation? Do you have an on-call expectation? Is your help desk 24/7, or are certain applications unavailable at specific times? Do you have daily downtimes for backups? Ticketing priorities, response times, escalation process, breach ticket protocol. Will your augmented IT team have all the access to all the systems, or is there a limited access for certain members of the team? For example, we've worked with clients that have a separate IT team for ambulatory care versus their hospital-based care. The hospital system is the truth for all MRNs. Prior to merging duplicate accounts in the ambulatory care setting, the hospital database needs to be checked to confirm the correct medical record number. If your ambulatory IT team does not have at least view access to the hospital system database, another resource will need to be engaged to verify those accounts, thus slowing down the process of correcting a patient's medical record. How do your end users access their help desk? Are they calling a help desk phone number, or are they able to access the ticketing system in a self-serve format and enter the tickets on their own behalf? This is important, as often users who call into the help desk are probed by the staff for more critical information that we need to investigate the problem, rather than logging the tickets on their own. Do you have a dedicated line for the providers to call with application issues? If so, how is that managed, and what is the expectation for the service? Is it the same as the originating SLA for tickets, or is this different? Knowing the key problem tickets in your organization and knowing how they are resolved, we bet that there are duplicate accounts locked out of the application and the system is running slowly. Are you open to suggestions of changes in workflow that may help reduce costs or more evenly distribute the work? For example, if you consider password resets a Tier 2 support, would you consider alternating workflow/security or permissions to allow them to be Tier 1 tickets? What are the daily, weekly, and monthly job tasks that now need to be addressed with the new help desk? Examples of the daily: patient management early morning status check, monitoring error queues, addressing the errors either by refiling or building out the order code, duplicate accounts in the patient merges, and monitoring inactive task lists. Weekly responsibilities: are there staff department meetings that need to be attended? Who will be responsible for budgeting, forecasting of money and hours on the project, coordinating larger build projects, activating and inactivating orders, sending off error queues to the interface team? How about monthly tasks, such as the end-of-month checks and reports, program upgrades, on-site support requirements for go-lives, or one-on-one training for your staff? We will own this responsibility as much as your staff, because at the end of the day, it is about providing quality care and accurate records. Some more important questions to have a dialogue about are: what are the process when duplicate accounts are identified? Who is identifying and reporting them? Is it the end users, HIM, providers? Is it an IT responsibility to investigate and correct, or is there another department whose responsibility that falls to? Are there other systems or databases that need to be reviewed for duplicates prior to our corrections? For example, referring back to the example discussed on the previous slide, where the hospital system is the truth for the MRN, prior to merging duplicate accounts in the ambulatory care setting, the hospital database needs to be checked to confirm the correct MRN. We have observed the report of a single duplicate account requiring system checks in 4 separate applications: IDX, Epic, Allscripts, and the CMS Merge tool, and reviewed through 5 different departments, from the site end user to the help desk IT, to health information management, to the Epic team, and then back to the IDX Allscripts team, prior to even being able to complete that request. What is the process when the charts have been merged incorrectly, resulting in 2 patients' health information now residing in 1 medical record? Again, whose responsibility for investigating and untangling the records? Is it the IT team or health information management? Do you need an incident report to be completed? How about when documents are scanned into the incorrect chart? What is the process for that correction? Who is notified? How are they notified? Also, who has the security to move the incorrect documents? Again, the observe, interview, and documentation methodology will come into play here with all 3 of these scenarios, as charting errors and duplicate accounts are a frequent, recurring theme in most health organizations. Value and quality-based incentive programs. What programs are you currently reporting to? How is reporting currently managed? Will that team remain in place during the transition? Is there a value-based quality team that meets on a regular basis And who decides what measures to report against? Who is monitoring those reports and measures for updates and changes? For example, screening for diabetic eye exams. Is there someone specific who is checking the program to ensure that patients who are marked diabetic are getting their eye exams in the value-based time period? Are you currently doing site visits to review the compliance programs and address concerns? If so, is it one person or more than one? And how often and long are these visits? For example, we've seen a very large multi-state organization have only one person doing site visits to explain the value in quality-based incentive programs. This wears that person out and can limit the time spent per office. If you're utilizing reporting services that have licensing fee requirements, such as direct IDs, how is that service agreement going to be managed? Who will be responsible to request the additional licenses and deactivating licenses for providers who have left the organization? At the end of the day, if we're not taking over your quality-based initiatives as well, our relationship with the quality team is crucial and directly linked with the day-to-day work in the applications. And it is important that we have an understanding of their overall plan of your organization.
Thank you, Sarah, and everyone else for that informative and insightful presentation. I'd like to take a moment to touch on some of the services that we offer for application management. These include legacy system support and maintenance, as well as help desk operations. We also offer project management resources for system and application upgrades and provide training programs for end users, admins, and super users. To wrap it up, before we get to any questions that people might have, why choose Galen? We have a lot of community support. I encourage you to visit our Knowledge Center on our website, where you can see white papers on all of our solutions and read some of our success stories. We have a pretty big footprint in moving healthcare IT forward, and we are always looking to freely share our knowledge and our experience. We've produced over 620 blog posts and over 200 webinars just like this, also available for viewing on our YouTube channel. So we encourage you to visit our website, www.galenhealthcare.com, and experience the difference with Galen. The slides from this webcast will be available on our public wiki shortly after the conclusion of this presentation. If you have any questions, please feel free to put those in the chat box at this time. It looks like there weren't any questions, so we'll wrap it up here. Thank you very much for attending today. If any additional questions arise, you can contact us through our website or email education@galenhealthcare.com. We hope you have an enjoyable rest of your day.